Hospital workers, what regrets do you hear from dying patients? 1. I was a hospice nurse. One of my elderly patients had skin cancer, a huge malignant melanoma on the side of his neck that was growing rapidly. He had been a farmer all his life and never married. One night we were talking and I asked him if there was anything he wished he had done differently in his life, and he thought about it a minute and said he wished he had worn a hat when he was farming. I wish he did too. 2. I work in a hospital. Whenever someone is at the end of their life, they always just want to be with their loved ones. Any regrets I've heard is always family related. They wanted more time with the people they love. Most people are at peace with things though. People also tend to wish they took their health seriously. 3. He wished he had been a better father to his daughter. He wished they had reconnected. His dementia prevented him from remembering they had reconnected years before and that she visited often. I wish I could have made him aware that he had accomplished his last wish, but he died not really understanding that. 4. In the ER it's not something most people see coming when they arrive, but it's usually the same regret when they are coherent. They all wish their family was there, which sucks even more lately with COVID since family can't come in initially. Or they cry out for their so in a panic. It's gotten to the point recently where we tell them so is right here with you. The look of relief on people's faces just hearing that gets me every time. People just want to not be alone at the end. 5. I had a patient who I was in the room with when her doctor explained she only had a few weeks to live. I knew her well. Spent quite a bit of time talking to her up to the news. The days that followed, she seemed to have accepted she was dying. She lived this beautiful, independent, and successful life, maybe not money successful, but just plain happy. Anyways, when I was helping her to the tub on day 10 since receiving the news, she just broke down crying and couldn't stop crying about how much she wished she didn't put her dog down. They could have died together. Come to find out her dog was on his deathbed too. I guess she put her dog down a few days before going into the hospital. She knew her life was over so she put him down first. She hated herself for it and for the fact she blew the opportunity for them to spend their last moments together. Really heartbreaking to watch, to hear that unfold. She passed early in the morning 2 days later. I took a couple of mental health days off after she passed and spent some time looking up dogs to adopt and new jobs to apply for. 6. My mom did home health and hospice. My stepdad was very abusive and my mom would take me to work with her to try and protect me. She didn't want to leave him due to religious beliefs. That's a different story. There was an old man. I'd play cards with him. We'd talk about working on the farm we had. He was a nice guy. He figured out I was being physically abused. His health started declining and he couldn't play cards or get out of bed. The last time I saw him, he said he was sorry he wasn't younger and that he couldn't help me. Almost 25 years ago and I still remember him. 7. I remember of this 40-year-old patient that I had was dying from breast cancer that spread throughout her body. She was diagnosed with breast cancer 10 years earlier and had a mastectomy. The doctor recommended for her to have a bilateral mastectomy with reconstruction due to high risk of recurrence of cancer. She said that she wanted to keep her breast, a real breast rather than an implant, in case she remarries and will be somewhat whole. She regretted not getting the bilateral mastectomy. If she did, she would not gotten cancer in her remaining breast and dying at such a young age. The patient never ended up marrying after all. A week later, I was diagnosed with breast cancer. I instantly told the doctor that I want a bilateral mastectomy with reconstruction. I also had an aggressive form of cancer. My doctor kept pushing a lumpectomy, which I probably would have gotten before I have heard how much she regretted her decision. I feel that she actually saved my life sharing and opening up with her regret of all time.